Hi, I'm Dr. Diane Ferris, and I've been a practicing chiropractor for nearly 20 years. I want to explain a little bit about chiropractic and take the myth out of chiropractic. Chiropractic has actually been around for over 100 years, and it's been safely used for a lot of spinal conditions, one that we're particularly known for, low back pain. So what does the chiropractor actually do? We actually look to the spine and see the segments that are moving and are not moving. And those segments that are not moving, we employ a force back into that area. We can do that in a number of ways. We can either use our hands in different techniques that we can use our hands with. We can use the tables that are table-assisted adjustments. And there are also handheld tools, some which are called activator, that can also be used to restore the movement back into the spine. So the whole point is that we want to restore function, movement back into those segments, those areas of the spine that are not moving. By restoring that function back into the spine, it relieves the discomfort that people are having, restores the movement, and basically people start to feel better. Your first appointment for a chiropractic adjustment would look just like any other appointment that you would go to your doctor's office. We take a thorough health history. You have an examination including your blood pressure, your weight, all these other components that you're normally used to going into a doctor's office for. But one big difference is that we do postural evaluations. We're looking into that area in which your complaint is about, whether it's neck pain or back pain. We're looking at in the movement of those areas. Is the spine moving in the directions that it should be moving? What is restricting that area? So we're getting all the information that we need to do in order to get a proper diagnosis so that we know how we can treat you. After the examination, many times a x-ray is taken in that area so we can see what the structure looks like. It also gives us a lot of information to not only your condition and your diagnosis, but what type of technique would be best suited for you. When it's talking about we sometimes use our hands, there's different techniques that you can employ using your hands. Basically, all the schools teach the same type of technique, so it really has to do with the provider that's giving you that adjustment. Names such as diversified technique, Gonstead technique, these are all techniques that are taught in school, and each of the providers, it's up to them to sort of develop their art and be able to deliver that type of adjustment. There's also other adjustments when perhaps you're not going to use your hands that are table assisted. You can use a technique called Thompson technique, which is using the table actually to help assist with the adjustment. There's also other techniques called flexion distraction, which is very successful in using for radicular type of symptoms that a patient may have. For those patients where hand may be not the right type of adjustment, we can use handheld devices such as the activator, which is the technique that I use for a tool-assisted adjustment. But the whole point is, whether you're using this technique or that technique, the whole point is restoring function back into the spine, trying to get the spine back moving. That is what relieves people from their pain initially. Also, it's not the only thing chiropractic could do. It's the main thing that we do. That is what we're known to do, and we spend many years actually learning how to deliver the types of adjustments that I have just talked about. But we can also employ physical therapy type of modalities to help heal that area. We use stretching and exercise to rehabilitate the area as well. Soft tissue techniques are sometimes also used to help warm up the area and to help with areas that have maybe a lot of tightness or adhesions to them. So there's lots of things that a chiropractor can do for you. I hope that you decide on chiropractic. Chiropractic is the #1 complementary and alternative health care, and there are so many good providers out there just willing and able to help you. So I hope that this answers some of your questions. Thank you.